Good afternoon, everybody. I'm Rhonda Smith, the Executive Director of the California Black Health Network, and welcome to the fourth session in our five-part series on making the healthcare system work better for you. Today's session is on the topic of advocating for yourself and your loved ones. Like, we know that patient advocacy is the act of expressing and highlighting your rights and desires as a patient and individual, and making sure that you are seen and heard when you're in a healthcare setting. Patient advocacy is also communicating with your healthcare providers and team so that you get the information that you need to make informed decisions about your health and healthcare, and also navigate the healthcare system much more effectively. So the question of the day is, how do we communicate and advocate for ourselves and our loved ones in a way that does make the healthcare system work better for us? Now, we're very fortunate to have the opportunity to partner with the California Healthcare Foundation to help provide the answer to that question and more. Our partnership with the foundation enables us to elevate health education and health literacy through the How Do I campaign, an initiative to provide the knowledge, skills, tools, and resources to empower Black Californians to take charge of their health and healthcare and really own that power when interacting with the healthcare system. So the How Do I campaign was evolved from one of the recommendations that came out of the Healthcare Foundation's listening to Black Californians research, which was a project to really understand what happens when Black Californians interact with the healthcare system and what that experience is like for them. So we want to make sure that our work through the How Do I campaign helps our community know how to navigate this complex healthcare system so that we are all seen and heard, and ensure that we get the care we need and so deserve, and ensure that the healthcare system is more responsive to our needs. So once again, we are delighted to have as our subject matter expert and featured speaker for the series, Dr. Glenda Newell-Harris, who is the co-author of Focus on Your Best Health, the Smart Guide to the Healthcare You Deserve. So the book was really created to teach healthcare consumers like you and me how to communicate, navigate, and advocate for ourselves when we are interacting with the healthcare system. But before we start with the program, just a few housekeeping rules. So we'll hear from Dr. Glenda, and then we'll have a Q&A. So if you have any questions whatsoever about what she's talking about today and anything else that comes to mind, please put them in the Q&A box. The Q&A box, the chat box is open. So I've seen some people say hello to everyone already. So if you see someone that you know, we just want to give a shout out, please feel free to do that. So we'll all remain muted and off the screen during the duration of the webinar. So before we get started, just wanted to, for those of you who may not know much about the California Black Health Network, want to tell you a little bit about who we are and what we do. So we are the voice and trusted resource for Black Californians here. And we are the only Black-led statewide organization that advocates for health equity for all Black Californians. We do outreach, education, policy, and advocacy work, as well as programmatic work to really close the gap in health disparities and advance health equity for all Black Californians. And we do that through the lens of looking at things at the intersection of racial justice, social justice, and environmental justice. Next slide, please. And our vision really is to create a California where every African-American and Black immigrant has the opportunity to live a long, healthy life free from violence, racism, and health inequities. And we do that every day through our mission to ensure that every Californian, every Black Californian, no matter how much money they make, where they live, how well educated they are, no matter who they love or how they self-identify, their housing status, or even immigration status, has the opportunity to have access to high quality, equitable primary as well as behavioral health care, and definitely not succumb to diseases and those that for sure are preventable. So without further ado, I'd like to turn it over to Dr. Glenda. I will give her an introduction. Next slide, please. And so Dr. Glenda Newell-Harris is a distinguished physician, author, speaker, and patient advocate. With a career spanning decades, Dr. Newell-Harris has been at the forefront of addressing health disparities and championing equal rights in terms of access to high quality healthcare for all. She has been providing healthcare to diverse communities and underrepresented population for the majority of her career. She is a physician leader in internal medicine and a trusted voice and go-to expert for her patients, family, friends, and communities around the world. She educates on issues around healthcare and health advocacy, and her mission is to empower everyone from both sides of the relationship, the doctor-patient relationship, and from an extraordinary life experience standpoint, to really be able to advocate for themselves and navigate through the healthcare system much more effectively. She received her BS degree in biology from Tufts University in Massachusetts and her medical degree from the University of Cincinnati School of Medicine. And most of all, to mention that in February of 2024, she was appointed by President Biden to serve on the advisory committee for the Office of Minority Health. She currently resides in Oakland, and there's a lot more I could say about Dr. Glenda, but I'll turn it over to her to share with us information about how can we really advocate for ourselves and our loved ones to make the healthcare system work better for us. So Dr. Glenda, take it away.
Wonderful. Thank you so much, Rhonda. I really appreciate that very generous introduction, and good afternoon, everyone. Kudos to anyone that has been able to make this fit into their schedules for more than one session. We are now into the session that I think maybe some of you have all been waiting for. Let's get into the next slide. Today, we're going to talk a little bit about advocacy. The importance of how to advocate for yourself and your loved ones. Now, I'm going to talk to you about this today, but I want to let everybody know that all of you have already done this. And so really today, my hope is to be able to just help you refine it, help you feel good about, next slide, help you feel good about what you are doing and how to really make it better. But before we get started to talk about advocacy, I want to just recap just very, very briefly about some of the previous presentations. So in the first presentation, we talked about patients' rights. We talked about the importance of you getting clear information, your choice of provider, your choice of being able to go to an emergency room, the importance of being able to report complaints and appeal. The next session, we talked about communication, and that the 4 key components to communication are effective communication, verbal and nonverbal communication, as well as active listening, written and electronic communication. If you were not able to listen to those and be available for those, I know that they are available on the California Black Health Network's website. So that information is still available to you. And then the last time we met, we talked about how to navigate the healthcare system, including familiarity with health plans, selecting the right primary care doctor, understanding your health insurance, and knowing what to expect when you go to the emergency room. Next slide. So today we're going to talk about patient advocacy. Now, advocacy is something, as I said, you've been doing. Anybody that is part of this webinar that has children, anyone that might be taking care of an elderly parent or a friend, if you have accompanied them to a doctor's appointment, X-ray imaging appointment, or in particular, an emergency room evaluation, you have likely already served in the role of patient advocacy. So what is advocacy? Advocacy is the voice of the patient and bringing clarity to the medical experience. Next slide. Why is patient advocacy necessary? Why are we even talking about it? Why is there even a session on it? Why did Sarah Lawrence University in New York become one of the first institutions to have a specialized program on patient advocacy? Yes, more than 10 years ago, when we were doing some of the writing and the research for this book, we found out that Sarah Lawrence University in New York was one of the institutions that had courses on patient advocacy. You can go and Google UC Berkeley right now. Many people are having courses about this topic, but it is so important because it addresses the ease of trying to navigate the burden of the healthcare system. And if any of you have ever been involved in the healthcare system, I think you will agree with me that it definitely is burdensome. The other important aspect of patient advocacy is improving your doctor-patient communication. And I'm also going to say a relationship, because really, at the end of the day, your relationship with your doctor is critical. I'll tell you, if you're trying to get an imaging study or some kind of an appointment, and if you just call by yourself, they may tell you, well, we don't have an appointment for 3 or 4 months. But your primary care doctor sometimes can pick up that telephone and talk to that colleague or talk to the x-ray department and get you in for that appointment a lot sooner than you can do on your own. So it is really, really important that you nurture and value that relationship with your physician. Now, if we live long enough, we're all going to probably have all kinds of physicians. Some of us have cardiologists, some of us have hematologists, some of us have dermatologists, some of us have general surgeons. And you know what? You need to make them all feel special. The primary care doctor is the one that sort of is the traffic cop that directs you to go here and to go there. But at the end of the day, when you're getting ready for surgery, let me tell you, it's between you and the surgeon. And don't forget the anesthesiologist. They put you to sleep and they wake you up. So we all thank the surgeon for doing such a great job. But trust and believe, if there was not a great anesthesiologist back monitoring what was going on with your blood pressure and your heart rate, they sort of position themselves over back where your head is. They are as important and critical. So know who your doctors are, know what their specialty areas are, treat them all with loving care, and understand and know that there is a relationship necessary with each and every one of them. Next slide. The role of a patient advocate. So, we're going to talk here for just a moment about personal advocacy versus professional advocacy. And so you see that term professional advocacy, and you might say, gee, what's that? And how do I get that? So let's talk first a little bit about personal advocacy. A personal advocate is someone that offers you emotional and practical support. It might be a friend or a family member or someone that's very close to you. They help you navigate the medical decisions that you make. They also want to ensure that your wishes are heard, and they want to be able to help you feel comfortable asking questions to the provider about things that you really are not sure about. They are generally individuals that have no formal training or expertise in healthcare. So this could be easily a family member, a friend, someone who may not be in the health field, but someone that knows you, that will go with you to the doctor and listen and ask questions. Because the very questions that you talk to your friend about may be the questions that, for whatever reason, you may be fearful of asking the doctor about in that appointment, and your friend might be that person to help sort of break the ice there. Now, let's talk a little bit about professional advocates. Professional advocates are those that provide expert guidance and specialized services in helping you be able to navigate the healthcare system. It is someone that specializes in understanding and knowing healthcare systems, patients' rights, and medical terminology. They are generally individuals that work in the healthcare field, and they are there also to be able to provide you with some of the same things that your personal advocate will bring, which would be emotional support, understanding, and anything that's going to make your engagement and your relationship with your provider and your treatment course of your situation the best. Professional advocates might be registered nurses, LPNs, physicians, nurse practitioners, anyone that has had some experience in the medical field and may therefore be able to bring and lend that additional information and their expertise and knowledge to your personal situation. Next slide. What makes a good patient advocate? So you might be sitting here thinking, oh, I can't do that. I just don't think that I'm equipped. I really don't know if I really have what it takes to be a patient advocate. Well, let me just give you a little story of something that happened to me. And of course, I'm a little different because I am a physician, but I remember being at the bedside of a loved one. And the loved one, had been hospitalized for a surgical procedure, and it was getting very late into the night. And the IV, and people, I think everyone on the call knows what an IV is, had stopped. The bottle had emptied, and the nurses sort of missed the window of opportunity to notice that had happened. So the nurse went flying into the room and said, "Oh my goodness, the IV is out." Well, when the IV runs out, if you don't keep fluid running in, then the intravenous line that's put into the vein can get clogged up. And that means somebody has to start all over. And that's no fun for anybody. So they ran out of the room, got another bottle, hooked it up very quickly because they wanted to make sure that IV didn't clog off. And in their haste to hook it up and set it up, again, this is late in the night. I'm there at the bedside. They failed to adjust the amount of fluid that was to come out of the bottle over a period of time. And so basically what happened was they did a wide open IV line. So the fluids just poured in. Now, I was at the bedside of a more senior family member. And of course, again, I was dozing because I wasn't there to be a doctor. I was there to be support. I was there to be an advocate, not feeling that I was a professional advocate, but more that I was a personal advocate. And all of a sudden, I guess maybe about 2 hours later, another nurse flies in the room, and then she's hysterical because, oh my goodness, that bottle is now empty. Well, then I woke up. I completely woke up at that point and said, okay, now we got a problem, because fluids that go in too quickly can lead then to an overload of fluid in the lungs called pulmonary edema. And this is how and why sometimes patients go into the hospital with one problem and then they get other problems because other things happen. So as an advocate, I then said, wait, hold on, what happened here? And it's just a matter of just kind of asking questions. Now you might say, well, I don't sit at the bedside of people and I don't know how long that IV is supposed to run in. But there are many of you that have been with your family members and you've been by the bedside and you've watched how frequently they change that bottle. And if they have been changing that bottle every 8 hours, and then all of a sudden you notice they're changing that bottle every 2 hours, that's a reason to ask a question. Why is it that grandma was getting these bottles every 8 hours for the last 4 days, and now you're doing it every 2 hours? So, of course, I woke up and then I had to shift into professional advocacy mode and ask for the supervisor and ask that my loved one be evaluated by a provider because I knew what could happen. And, then I did become a little extra, as my kids say. I asked that an incident report be filled out because it had the potential for a problem. So, what am I saying here? I'm saying here that you don't have to be a doctor to know that if every time grandma goes into the hospital, generally those liter bottles are changed every 8 hours. And if they're being changed every 2, there's a reason to ask a question. And of course, you can also watch the body language of the nurses. When they start looking fearful or concerned, you can just simply say, well, what happened? And ask that question. Some of advocacy is simply asking the question, asking about things that don't make sense, because believe me, if they don't make sense to you, they don't make sense to others. And many times we as medical folks think that the family is just there, just hanging out. I'm about to sneeze here. Excuse me just a second. They just think you're hanging out. And when you pose questions, it sends a different message. Oh my goodness, they're paying attention. We better be careful about what we say and what we do. So, what makes a good advocate? The ability to actively listen, ask relevant questions, and communicate effectively. And I talk about communicating effectively because I think in the first session on the second session on communication, I talked a little bit about being politely assertive. That's a very important um, aspect of communication that we must all learn to master. When our loved ones are sick, I know we get very anxious, we get very excited, we get nervous, we get worried, we get animated, we get passionate. And sometimes that passion can be perceived as anger, and you definitely don't want to anger the folks that are taking care of your loved one. So you want to ask questions to be politically, what we call astutely, politely assertive, and in a way that is caring. What is nice to have in a patient advocate if that patient advocate has medical knowledge or healthcare experience. That's why I mentioned registered nurses, nurse practitioners, LPNs, they work in hospitals. They know how things go. They may not be able to tell you how to treat the hypertension or to treat the heart disease, but they've been in the building long enough. They've watched physicians and nurse practitioners long enough to know that this is not generally the way that I see things. So these are some very, very important characteristics that need to be considered when you are looking to be a patient advocate. Next slide. So advocacy tips. Before we move into advocacy tips, let me just share with you a few situations that I can talk to you about from a personal perspective of things that I've been involved in with either friends or family that I want to take the time to share with you to just sort of bring this home and make this real to you in terms of the importance of advocacy. I actually had a very dear friend who developed, and I don't want everybody now who ends up with vomiting and diarrhea to think that this is going to happen to you, but she developed a very normal, what appeared to be normal case of vomiting and diarrhea. And she thought it was the flu. And so she stayed at home with it for several days. And then ultimately, it became so bad that she went to the emergency room. She was seen in the emergency room, evaluated by the emergency room doctor, and told that it was the flu, some type of a virus, and she needed to just go home and let it resolve. Now, I don't know if you get my drift here, but interestingly, she took herself first to the emergency room. I think that's one important thing that I want folks to realize is the importance, and this is number 2 here about advocacy, choosing the right primary care physician. Your first point of contact when you're sick really should be your primary care physician. That's the person that knows you. That's the person that has seen you when you're at your best. That's the person that may have seen you when you're at your worst. But they are able to know that something may be different with you. And sometimes they will ask you to come on into the office and be seen in the office rather than to be triaged to an emergency room. So, my first point here is to try to remember to reach out to your primary care physician when you begin to notice some type of problem. Now, what happens to many of us is that we wait until the problem is so severe, we can't stand up, we're so dehydrated, you have to go to the emergency room. In any case, my friend went home, tried to recoup at home for several days, continued to have the problem, went back to the emergency room, got the same story that it was a virus. She was an adult and decided, her mother called and the mother said, well, you know what? I'm not accepting that. And I'm going back up there with you to the hospital. And her mother did. And with her mother's insistence, and her mother was not a healthcare professional at all. And her mother's assistance and persistence led them to find out that my friend actually had a condition where her bowel was what we call necrotic. She had a bowel infarction. She had lost blood supply to her bowel. And therefore, this was a much more serious condition than just viral gastroenteritis. She had to go to emergency surgery and have a portion of her bowel resected. And there were other complications that came about as a result of this. But my point is, You need to take people with you when you go to the doctor, when you're sick. As has been pointed out before, when you are ill, you're often not able to really give a good history because you feel so badly. You may have lost track of time and you may think, well, I was okay and I ate yesterday. But the family member will tell the doctor, no, she hasn't eaten in 4 or 5 days and all she's had are sips of water. So you must bring someone with you to the doctor. And we also say that you should really never go to the emergency room without an advocate. We're out of the excitement, so to speak, and the concerns of COVID. And so now you can bring people with you to the doctor, and generally they can come with you into the emergency room. Do that. Go find a friend, someone, spouse, girlfriend, anyone to go with you. And keep share your story with your intimate friends so that when you get to the doctor, they will be able to hopefully get some of that history from your friend and be able to help to make a decision about the best kind of testing that you need. So let's begin to start talking about some of these advocacy tips. One of the first things that we have here is to get the right health plan. Now, that is something that you will do on your job. Your job will offer you different health plans. So it is very important that you look at your own health, look at the health of the other adults in your family, your spouse or significant other, and look at the health issues that your children may have. And you want to pick a plan that is going to be work best for you. Some plans are PPOs, and I think we've talked about that. Some plans are HMOs. Kaiser happens to be an HMO plan. There are PPO plans where you get to pick your doctor and make all of your decisions. In terms of if you want to go see a dermatologist, you go see one. You don't need anybody to give you a specialty referral to go there. If you want to go see a cardiologist, you can go and see one. But let me caution you about that part of health if I haven't already. You do have the right with a PPO to pick your own cardiologist, dermatologist, hematologist, oncologist, pulmonologist. But when you are going out there doing that, keep in mind that really someone needs to be holding it all together. And if you are not certain that all of your specialty doctors that you reach out to are funneling, sharing all of that information with your primary care doctor, you could go in and see your primary, and especially if they're not in the same network, you could go in and see your primary care doctor, and your primary care doctor has no way of knowing that you have a problem with your lungs that's being evaluated or that type of thing. So when you choose your healthcare plan, be certain that you fully understand the healthcare plan and how it's going to benefit you. Number two, we've already talked a little bit about this, but choose the right primary care physician. And so when I say right, you might say, well, what do you mean by that? Well, I really have to say to you that I think a relationship between you and your primary care physician, it's got to be a chemistry. You're telling this person, man or woman, all you're answering all of the most intricate things about your life. We as primary care physicians, we will ask you everything. We'll ask you what you had for breakfast. We'll ask you how many sexual partners you have, and we're expecting you to tell us the truth because we're not passing judgment. We're really trying to make sure that we're managing your care properly. We will ask you how frequently you have bowel movements, how frequently you go to the bathroom for urination. We ask you everything and we're expecting to get an answer. So there's got to be some really good chemistry going on between you and your primary care physician. So if by some chance you identify a primary care physician and you don't feel that they're connected with you, you don't feel that they are hearing you or reading you, then that's the time for you to talk to your friends about who they are seeing. And as I think I've told you in a previous session, the best referral for another doctor is another patient. So choose the right primary care physician that works for you. The next comment I have here is partner with your doctor. Now, we've talked a little bit about that, but it is a partnership. I can tell you I've been in some situations with my doctors, And I have had goals of things I want to do. Let's just say that your doctor says to you, you've got an acute gallbladder and you really need to have that removed. And you might say, not now. I've got, my company is sending me to Germany next week. And I've got, a 5-year-old that's got a big birthday party and I can't miss it. And, you may even be saying things like, I'm traveling to Washington, D.C. in January. I can't be suffering from any aches and pains. And your doctor might then say to you, well, okay, I think it's okay for you to wait on that surgery for 6 weeks to a month. But I don't think you need to wait 6 months. And that's what I mean by partnering with your doctor. But if your doctor says to you, you know what, I wouldn't wait that long if I were you for this surgery, not gallbladder. I'm speaking of other things. So but you do have to have that trust that they are giving you information that is going to be in your best interest. And it's a beautiful thing when you feel like the doctor is working with you, that they hear you. So it's like, oh, wow, okay, I get to take that trip. But when I come back, I'm going to be on lockdown. I'm not going to be able to run around and do things because I've got to take care of myself because you are to be here for the long haul. That's the plan. The next comment is be actively engaged. And I'm going to say in every aspect of your healthcare, be actively engaged in your appointments. So that means, I know how busy we all are and how important we all are, but we should put our phones in our purses when we're in our doctor's appointments. I know you're the CEO, you're the COO, you're the CIO. Everybody's asking you questions and your phone is blowing up. But guess what? When you are no longer there to answer the questions, they will pass those calls over to someone else. So take care of yourself. Be engaged with your doctor in that 15 or 20 minutes that you have them. And that is a time where you have hopefully come prepared to ask the questions that you need. Again, you are then advocating for yourself. We didn't even really talk about that. Most of the earlier part of this presentation, we talked about advocating for others, but you have a responsibility and obligation to advocate for yourself. And all of these things are necessary in self-advocacy. Bring someone to your appointments. I don't think I could talk any more about that than I already have, except that I will say this. The only other place that I feel that you really need to bring someone to the doctor with you is we mentioned the emergency room. The other time you need to bring someone with you to the doctor is when you are anticipating getting news or feedback from the doctor. So if you've had x-rays, if you've had CT scans or imaging studies, and you think there's going to be discussion around that, and you are not sure how you're going to, if it's not all negative, and then even sometimes when you get all information is negative and you still got the problem, my question would be, well, okay, all the tests are negative, but why am I having this, that, or the other happen to me? So I encourage you to bring someone with you because I will tell you, if you ever go to the doctor and you're awaiting a report and that doctor comes back with some news that you're not expecting, particular cancer, I promise you, you don't remember anything else the doctor says. Everything else just goes completely over your head. And even if the doctor says to you, hey, this is a cancer we can treat. And this is something that we've we've studied it for years and years, and people do really well. And, we picked up this early, and we have this treatment for you and that treatment for you. And, the survival rate is just, they start rattling off numbers to you. I promise you, you don't hear any of that. You won't hear any of that. You walk out with your head hung down thinking, why me? And your friend that's with you there is hopefully walking out saying, wow, I mean, this is horrible that it's happened and we're so sorry. But listen to all the great things that the doctor said. So bring someone with you to appointments, especially if you think you may be getting some news that you're not certain of. The next point is if there's a long wait to book an appointment, ask to be placed on the wait list. I think many people forget about that. I know with my health plan, within the app, it allows you to be able to be asked to be on the wait list. And I will tell you, I get emails all the time giving me times and dates of the appointment that I'm trying to get into. They are offering you times. And if you can't make that time because you're already committed, you can just hit the little button that says no, but you want to remain on the waiting list. And they give you a certain number of hours to respond. So waitlisting yourself for a sooner appointment is absolutely something that is an option for you. And again, that's you advocating for yourself because they generally don't recommend that you go on the waiting list. You have to be an advocate and ask for that. Let's go on to the next slide. Additional advocacy tips. You can see here that I've mentioned again, being politely assertive. That is so important. And I'll give you a little tip. This is something that my family, my sister and I have done over the years with family members that are ill. And you might say, "Oh, wow, you guys are really uh, interesting of how you deal with folks." But when our loved ones have been patients in hospitals, and we're very, very grateful for what the nursing staff has done. I will tell you, it is not. Uh, you should not be surprised if you hear that my sister and I have delivered, 3 dozen bagels at 7 o'clock in the morning to the nursing staff, and they're often like, "Well, who brought these?" And they'll say, "Oh, the family in room 2478." Does that make your care change? Hopefully not. But you know what? It probably puts a smile on their face when that room pulls that button that maybe they're thinking, "Oh, well, we need to go in there and take care of that person because, at least we got these bagels this morning, or we got, Chinese food for dinner." Or so, a little bit of loving can go a really long way. And having worked in hospitals for a lot of my life, a lot of eating goes on at hospitals. We do a lot of eating there, a lot of snacking. They keep things in the back room. Nurse practitioners and docs and nurses work very long hours, and sometimes they miss even their meals because they're filling in shifts for other people. So, spreading a little joy like that can go a really long way. Be aware of cultural sensitivity issues. And we've talked a little bit about that already, but it's so important that you ensure that your doctor honors your cultural the aspects of your culture that are important to you. I know I have taken care of patients that are of the Muslim faith, and during the time of Ramadan, it is you don't just say, "Oh, well, you don't eat until nighttime. Well, you know what, this isn't going to work." No, you work with the patient. You figure out a way to try to help make things work for them, to work within their cultural needs and desires. Seek out resources and support groups. These are all available to you, and they can also be a great source of support for you for advocacy as well. Because in talking to others, you can find that they will give you tips of ways that they advocated for themselves, and then you learn from that, and then you can, of course, come back and use that same query to advocate for yourself. Because, like I said, there's a term that they say, "Closed mouths don't get fed." You have to ask sometime for things because things will not always be offered to you that are available. The next tip is request that doctors coordinate your care. I have to tell you, I had a situation not too long ago where I had several doctors that were involved in my care. And one doctor gave me one set of instructions, and the other doctor gave me another set of instructions. And of course, I had not even read them all yet because they were all preparing to come in and give me the information. And fortunately, the doctors read each other's information. And the one came in and said, "I see what Dr. So and so told you to do, this, and this. But I'm telling you, you can do that, but you can't do that until you get this, and this done." The coordination of care. So I listened to the primary doctor that told me, "You can do that, but I need you to wait and do that at a later time." Now, obviously, if you have questions about that, then you need to talk to all the doctors involved. But sometimes these doctors are moving so fast, they're writing things in charts and they're moving on. They're writing things in charts and moving on. And so you do want your care to be coordinated. In my particular situation, it was not a medication or a procedure or anything like that. So it was something that was easily understandable. But you do want your doctors to coordinate your care. And then seek a professional advocate. We've talked a little bit about that. I've done professional advocacy for folks. And I will tell you, the sad part about seeking a professional advocate is that many times your care does change. And I'm saying that it's sad because it shouldn't. But often when I am coaching friends and colleagues, when they come to me and they're concerned about their health care, I have them to sit down, we discuss the matter, and I begin to give them medical terminology because we know, we on the health side know that when patients who are not clinical begin to talk to us using clinical terminology, the care changes often, unfortunately, because then the doctor knows that you're talking to somebody else. Because why would you then start using medical jargon to discuss it with the doctor? They know, we know what's jargon, they know what's jargon. And so sometimes I have done that with friends and colleagues, and then they come running back saying, oh my goodness, guess what's going on now? Mama's getting this and she's getting that. And then they told me this, and I've got a social worker to help me, and I've got this and I've got that. And I really don't think that this care or the lack thereof is anything that is intentional, but it's all about folks being overloaded, overcommitted. Rhonda and I were speaking a little bit about this before our session today about the physician shortage and the challenges with us not having enough physicians in primary care medicine to be able to get things done. Just today, about 2 hours before this call started, I was on a call with a new physician that's part of my team. And this person said, I came out of private practice. She said, it wasn't even my own. I was working for somebody else, but I came out of private practice because I just was drowning in paperwork. And as physicians, we go to school to take care of patients. And so I'm going to ask you also in your advocacy to give a little grace to your providers because they are overloaded, they are extended, they're not enough of certain specialists to be able to provide care to those of us that need it. And then let me just share in closing, because I want to allow for a few questions. I want to share one other story about advocacy, and this actually happened in my family, where we had a family member that had abdominal pain, and the pain went on at home, and then the pain went on in the evening. And I'm going to shorten the story, but we got to the hospital, and the doctor said, "I don't know what's going on with the pain." And I may have shared this story in a previous setting because this is kind of one of my hallmark stories. But the short of the story was that I felt that the family member had an acute appendix. Everybody on this call knows what an appendix is. And the doctor didn't think that our loved one had an acute appendix. And they kept sitting on him and sitting on him and sitting on him in the hospital, watching and watching and watching and watching. And then the doctor says, "Oh, I've got to go and take care of a case in another city in a suburb of Oakland." I begged the doctor to stay, and I just kept staying there. I kept hounding the doctor. I, in fact, literally chased him around the emergency room. I have to tell you, I was desperate. And the long short of the story was they took my loved one to the operating room, and the doctor came back and told me that it was the largest appendix that he had ever seen in his professional career. And that instead of my loved one being in the hospital just a 24-hour period, because that's how they do appendix at that time, they couldn't be certain that the contents of the appendix, that the toxins may not have exuded into the peritoneal cavity and therefore caused a total body infection. So then we had to do 3 days of hospitalization, 3 days of intravenous antibiotics. And for those from utilization management standpoint, that was 3 unnecessary hospital days and 3 days of antibiotics, making it a more expensive hospitalization than it should have been. But that was all about advocacy. I was like a dog with a bone. I was not going to leave my loved one there and go back home. And the mere fact that it was a near rupture was really a life-threatening emergency. So I say to you, if things don't seem right with your loved one, and if you keep getting no from the doctor or from the hospital, don't take no for an answer. Go back, call back, go to a different emergency room, call and hope you get a different doctor that will answer the phone or a different doctor working the emergency room. Because you, as an advocate, can totally save the lives of your loved ones. You can make things happen by simply asking questions. So I want, next slide. So I want everyone to walk away from our session today feeling just empowered to know that you are an advocate. You have already been an advocate, and maybe you want to do a little reading up and maybe, make yourself a little bit more professional or a little bit more knowledgeable. But I promise you, if you are going with your loved ones to regular ongoing appointments, you can almost become a professional advocate, because when you see things happen over and over again, you get that same knowledge and experience that we get as physicians, nurse practitioners, and doctors. So thank you so much. And I'm happy to take a few questions today.
Yes, thank you. Thank you, Dr. Glenda. I mean, you always drop a lot of knowledge on us, and I hope that everybody in the audience really appreciates you as much as I do. So we do have a few questions in the chat, and someone wants to know, does a patient advocate or personal advocate need to be named on the healthcare team directive? Yeah, healthcare directive.
I don't think that your advocate has to be on the directive, but it is very important that if you have a regular person that comes with you to the doctor, it is important that you notify your doctor of who that is and put something in the record that indicates that it's okay for the doctor to talk with that person about you. I mean, you'd be amazed in families. Sometimes the mother will say, well, you can talk to my son, but I don't want you telling a thing to my daughter, or vice versa. So if you're going to be there at the bedside on a regular basis, I think it's most important that you just make certain that the doctor knows. When it comes to healthcare directives, those are things that have to do with making decisions when you can't make them for yourself. And I think it goes without saying, if that person that's your advocate is also going to be that person, then yes, they should be. But for the purposes of what I'm talking about, being with you in the emergency room and being with you at doctor's appointments, there is not a need for you to be as a part of the legal document of the healthcare directive.
Great. And then just quickly, for those of you who are asking about or curious about the slides today, we will be sending the video out so you can watch the recording and then see the slides that way. So the next question is, please share strategies for how to advocate for unwilling patients and family members.
Unwilling patients, meaning I'm going to assume those are patients that don't want to go to the doctor or don't want to follow the, okay.
Or think that everything's all right, and even though their
Oh,
toe might be halfway falling off or something
oh,
like that. Yeah.
okay. That's a tough one, but I'll just give you a few strategies. I remember with some family members, sometimes we've just sort of said, can you do this for us? Can you just go to the doctor one time for me? Now, of course, you have to be on the good side of that loved one. You have to have maybe done breakfast for the last 2 weeks. You've carried them to all kinds of appointments. So it's got to be a little bit of a, because then they'll say, well, why for you? But if you're the one that's been taking them to the hair appointments and the nail shop, then you remove the need for the visit for the patient and put it on yourself. I've utilized that. Could you do this for me? And then once they get in there, they may find the doctor's not so intimidating, the situation's not so scary, the doctor's kind. They find out that the treatment is nothing like what they expected it to be. And then I ultimately resort in prayer after that, because it's really, really hard when you're seeing your loved one go down and they just don't want to seek care.
Yes, it's tough. So thank you. Next question is, how do you find a good primary care doctor? The one that this person had been seeing for years retired and had another one that seemed to be getting to know them well, but through the pandemic, getting to know them well through the pandemic, but now she's gone and guess they have to start all over. So like, what are the things you need to think about when you're trying to find a good primary care physician, which I know they're hard to find anyway, but if you have any insight or tips, that would be great.
So, I have to tell you, at different phases and stages of my life, I have different tactics. So, at my current age, were I to look for a primary care doctor, the first thing I would do right now is to look for somebody young because I don't want them to retire or die on me at this point. I mean, that sounds very silly, but you are looking for, sometimes people say, "Oh, I don't want a really young doctor." Well, I do because they are likely up to date on things. And so but really the best place to get a referral from another doctor is another patient. So I really would ask you to ask your friends, who is your primary care doctor? Now I'll tell you what'll happen. The doctors that have been around for a while, their panels are closed, and then they will often say, I'm not taking new people. But then I think what I do is I just sort of take a look. I go online just like you, and I look at the information that's there just like you have it. Where did they go to school? How long have they been out? I may look at their ethnicity, and I will just say sometimes, well, you know what? I'm just going to give this doctor a shot. And I'm going to go in and I'm going to see how it works. I've had more good luck with that than not. And so sometimes you just can't get a referral, but you just go onto the website. They have photographs most of the time that you can look at. And so if a friend can't tell you, then go on the website and look at the things. Also, convenience. Does the doctor have evening appointments? Does the doctor have appointments on a Saturday? Is the office open on a Saturday? All of those things matter. And as I said before, if you go and you see the doctor and somehow that chemistry is not there, then you just politely, bow out and find someone else.
Yes, thank you. And so if those of you who are interested in hearing more about Dr. Glenda's insight, we put the link in the chat to her book, which is Focus on Your Best Health. The next question is somebody wants to know where her husband had 2 heart attacks and a mitral valve, and they go for regular visits and he gets echo, but she wants to know, is that necessary?
Well, I'm going to say that if her husband has had 2 heart attacks and has had his mitral valve replaced, he's likely being seen by a cardiologist. And I will tell you that specialists generally do not order tests that are not necessary. So if the doctor is ordering an echocardiogram, I'm going to say, yes, it is indicated. It is a non-invasive test. It doesn't hurt. It's an external, as you know already. I'm sure if you've been with your husband, but I think information is golden. And we look at echocardiograms over a period of time because the echocardiogram can tell you about the ability of the ventricles to contract. And if your ventricle was contracting at 70% 3 years ago, and now it's contracting at 30%, we've got a problem. And
Yes.
so the doctor is serially likely looking at them because they're looking for something. I would say yes, always to that.
Great. And this one deals a little bit with transparency and billing. And so someone wants to know, how do you know if a hospital is charging a facilities fee and a doctor's fee or some other fee other than what you were actually there to get taken care of?
Sure. That's a great question. Well, there's something called an explanation of benefits. We use the term EOB, and those generally come from your insurance company. And your care with a hospital or a doctor, primary or specialist, is itemized. So if you get a CT scan with or without contrast, if you get it with contrast, there will likely be a line item there that somebody's got to pay for the contrast. And then there'll be a line item there that somebody has to pay for the CT. Now, interestingly enough, you'll get that bill for the CT and you think you're done. And then the next thing you know, you'll get another bill because the doctor has to get paid for reading it. So believe me, when you go into a hospital, there are so many little things that you are built for, but you should have the ability to be able to go through all that itemization line by line. And it should come from the hospital, but I will tell you from some of my own experience, the hospital likes to lump it up, but the explanation of benefits will generally give you everything line by line.
Great. And then do you have any recommendations other than what is in the chapter in your book about advocacy, patient advocacy, self-advocacy? Any additional readings that you would recommend for someone to look into?
You know, I there are some patient advocacy support groups now. And as I said, there are some universities now that are offering courses in this. When we wrote this book over 10 years ago, Sarah Lawrence was the only one. So I guess the thing that I would recommend to you is Google colleges in your community, and many of them are online. And there may be some courses that you can take from an educational standpoint that would educate you more about the whole notion of it. But honestly, advocacy is about experience and putting it to use and being willing to take the time to ask the questions because we're never asking you to be the doctor. We're only asking you to raise the questions so that the answers that you get make sense, are logical, and as I said to one of my doctors recently over the last several months, I'm tough. Seeing doctors is tough. Let me tell you, when you're taking care of doctors, it's tough. But I remember honestly saying, sometimes I think we as physicians get what it's like to be on the other side of this table. We're so busy giving out the instructions, we just forget what it's like to receive it. And I think that, your knowledge of advocacy and asking the questions should cause that doctor to pause and understand they just can't rattle that information off to you like they rattle it off to their colleagues because their colleagues, you do this every single day. It's desensitizing the doctor to the fact that there's a human being sitting on the other side of that table that doesn't practice surgery or doesn't practice hematology or doesn't practice pulmonary. And they really need to break it down in such a way that you understand it.
So I see someone has their hand raised, but if you have a quick question, please put it in the chat. I think that's Joy. Hurley, yeah, I know you and I both have been in a situation where we've had to advocate for our parents. And I think at some point in our lives, we are going to be caring for someone or we are going to be cared for by someone. And so while Joy maybe be putting her question in the chat, just wanted to ask you a few questions about, or a question about any advice on advocating for an aging parent with health issues and maybe some tips for that.
Yes, absolutely. I have been doing that for really over 25 or 30 years now. Um, and this is not in any particular order. I think it's important that you, at some point in the experience, even if you're far away, that you make the time to go to be with your loved one and go to that appointment with that loved one, with that doctor. I mean, it may be multiple doctors, but I think it's important that you go. It's important that the doctors see you. You obviously are living in a whole nother city or state, but they need to see you at least one time and make that connection that you are the daughter or you are the cousin or you are whomever this person is that you're connected with. That's one thing. The second thing is that it's really important, depending upon where your loved one is, that the appointments are kept up. And if you can't be there, if there is a caretaker in the home, it's important that you, as that remote person, that you connect with the care providers to make sure those appointments are not missed. Because that's where a lot of things happen with more senior patients. They're not going to go to things unless somebody drags them there or tells them to go there. So someone needs to be in charge of that, that they keep those appointments. And the other thing is, I think that it's important that you talk to your loved one and find out what their wishes and desires are, because many times your wishes as the advocate are not the wishes of the loved one. And sometimes it's because they don't have the knowledge, or they may be judging medicine based on what happened 50 years ago. And this is their, return to medical care. And their thinking is that, oh my goodness, you're going to have this, the doctor's going to recommend this treatment for me. Well, I know, 5 people back in 1948 that died of that. Well, things have changed. So it's important that you keep that dialogue open. And I also think that it's important that you make periodic visits. Again, if you're distant. Now, if you're close by, then I think the more you can visit and engage with that doctor and your loved one, the better off you are. Making certain that the medications are picked up, that the medications are taken, because many times, the patients just forget. And that's again where the caretakers come in. So it's a challenge. We're in that sandwich generation. Many of us are taking care of our parents, and then you're taking care of your children. And so that's another webinar to take care of yourself. But it is a full responsibility in caring for more senior parents. But just make sure that you do take some time for yourself, because nobody cares for the caregiver.
Great. Well, it is important to care for the caregiver. Yes, for sure. So thank you so much, Dr. Glenda, once again, for being here and for imparting all your knowledge and wisdom. We want to be respectful of your time as well as everybody else's. And I think you touched upon this, but if you want to run through this, great, in terms of summing up what we learned today, and then we can wrap up.
Sure. Yes. So today, I think we've learned what patient advocacy is, why it's important, and why you should have an advocate, what makes a good advocate, and then some general tips around advocacy. All these presentations have been a build up to today. Effective communication, savvy navigation, and appropriate advocacy will get you to have encounters of the best kind, and hopefully help you to be able to resolve or improve whatever your medical condition is. So thank you, Rhonda, and the California Black Health Network for giving me this opportunity to share.
Thank you. And if you want to follow Dr. Glenda, she has a blog, she's on LinkedIn, she's on Facebook, and you can visit her website. There's also information about her book, again, on focusing on your best health, how to get the healthcare you deserve. So next slide, please. And then for those of you who are still here, please, we would love to get your feedback. If you can quickly scan the QR code, I believe the link to the survey is in the chat, or will shortly be in the chat. Yes, it's already in the chat. So thank you very much, Sylvie. So please, we want to hear your feedback about the session today, how we're doing. If there's any other topic you would like for us to cover, in addition to this 5-part series, we would love to hear from you. So thank you in advance for your presentation. I mean, your feedback on the presentation today. And it really helps us with our quality improvement and continuous improvement efforts. Next slide, please. And then again, just a reminder for those of you who have been fully committed to this series, if you attend all 5 sessions, you will enter to win a $100 Visa gift card. We will let you know after the next session, which is on November 21st, who the winner is. So be sure to register for the next one session so that you can be eligible to win if you've participated in all 4 sessions so far. Next slide. And just to remind everybody about some of the upcoming events, on November 20th, we are doing a Cocktails and Conversation event in Inglewood. All the information about the events that we're hosting for the next couple of months are on our website under the events tab. On November 21st, we will have the last and final session for this series on how to participate in decision-making for your care. We have a health equity forum session coming up on November 14th with Dr. David Carlisle from Charles Drew University, talking about how we can improve workforce development to help drive better health outcomes for our community. And then we have a first ever Black Health Network member networking event in person in Orange County on Saturday. So if you live in Orange County or nearby in Orange County, we're going to be in Santa Ana. You can register to attend if you're able to make it and interested on our website too. Next slide, please. And you can continue to follow us. You can join us in the campaign for Black Health Equity. Connect with us on social. It's really easy. It's either the California Black Health Network or your CBHN. And that is all I have to say for today. Thank you all for coming. And it's not too early to say have a great weekend. So